lot of ideas.
I call Barbara Stewart.
Thank you, Mr Speaker. On behalf of New Zealand First, I'm very pleased to take a call in the estimates debate. From our party's point of view, it was good to see that there was an increase in the health budget, in Vote Health, but the bottom line is it isn't enough and it will never be enough. So therefore we need to focus on prevention rather than cure, because we're never going to have enough money to actually ensure that everyone has the health care that they like. So we're waiting to see action on non-communicable diseases in particular, and the government providing some education programs for parents and for children. Because there's no doubt, as the previous speaker said, these non-communicable diseases are on the increase. Our people are getting bigger, and people aren't aware of prevention at all. As it was said, we are now third in the world as regards obesity, rapidly closing in on the USA and Mexico. Not good when you see how big those people are over there. But there are good programs that are out in schools already that are actually subsidised by DHBs. And the one that I always like to talk about is Project Energise in the Waikato, a fantastic program that all the school pupils enjoy. It's got a whole lot of outdoor exercise, and then it focuses in on foods and sugary drinks, convenience foods. That is a program that needs to be implemented in other DHBs. We need to start somewhere and get that message out there, because there's nothing surer than the fact that we need to put a fence at the top of the cliff rather than rely totally on the ambulance at the bottom. The outlook in this area is not good, and even the New Zealand Health Strategy has said that there needs to be a change in the system with more emphasis on prevention and less on treatment. Now, one of the areas that's really important to me, and the Health Select Committee knows this, is oral health. I couldn't let this go past without saying something in this area. Interesting to see that over 29,000 children needed to have teeth extracted in 2014-2015.
I'm feeling like that's
so that means that 4 out of every 10 new entrant children are starting school with tooth decay, and some are even having their teeth extracted, baby teeth extracted, before they start school. And this has got a very detrimental effect on their adult teeth, because of course they don't come through in straight and they don't come in the right places, and orthodontic treatment is not provided by the state, and it is very, very expensive. I also know that many parents are not following through on the preschool checks for their children, or even school checks when one has to leave work to ensure that they take their child to the dental nurse, the dental therapist. It's very difficult to get away from work, and every dollar is really, really important. And quite often, it's easier to leave those children, let them put up with the pain, and eventually have the teeth extracted under anaesthetic. And this is an expense that could be reduced for the health system. There's an urgent need for cancer treatment to be improved. For all cancers, New Zealand's survival rate at 5 years is 4% lower than that of Australia. So this is an area that drastically needs attention. Elective surgery, we've heard that it needs to be increased. I was at a meeting this afternoon, and one lady was able to get one hip operation, but she can't get anything done for the other hip unless she pays for it herself. And as she said, she cannot afford to actually pay for it. So no doubt she'll be writing to me, and I'll be forwarding that letter on to the appropriate places. We know that extra dollars have been put into the budget for this type of operation, hips and knees, but it needs to be increased. bowel cancer screening. We heard the Minister talk about it. We're pleased to see that it is on the horizon, but that's where it is. It's a long way off for most DHBs, unfortunately. It needs to be rolled out in a far more speedier manner than is needed.
Barbara Kuriga.
This will be good.
E te tiamana